Have you ever experienced a deep pressure in your ear or woken up with some throbbing in your ear and thought to yourself, I might be having an ear infection? Well, I'm going to go through everything you need to know about ear infections, and my name is Dr. Anne. I want you to today quite literally hear me out about ear infections. Ear infections are generally very common and quite easily treatable, and often it depends on whether you have an outer or inner infection and how long you've had it for as to what the best treatment options are for you. Some people might get ear infections again and again, what can you do to prevent them? Well, I'm going to tell you all the need-to-know information. Ear infections can have a variety of causes, including fungal, viral or bacterial causes, and whilst most of them are easy come, easy gone, some of them overstay their welcome. How do our ears even work? Well, before we dive into infections, we need to know what our ears are made of and how they work. We obviously use them constantly, 24 hours a day, and they're in fact incredibly powerful. They can even keep hearing noises while you sleep and tune those in or out depending on what you need to know. This was essential for survival. Going back to the main topic, ear infections. In terms of ears, we normally divide them into outer ear, middle ear, and inner ear. They all have different roles and can help us with our hearing and balance. The outer ear has two main components. That's the pinna, which is here, and then the ear canal, which is just on the inside of here. This is an essential part of your ear because this is a gateway for sounds. It gathers sounds from the outside world and transfers it in towards your ear. Problems you can experience with this part of the ear often include swimmer's ear and a buildup of wax. Speaking of which, the wax that you have inside your ear is an essential part in keeping your ears nice and safe. The wax helps to pick up any dirt and debris before it travels further down your canal towards your brain and your inner ear. A common myth people think is that you need to use cotton buds to clear your ears. So how do you clear your ears? Well, generally you can use olive oil drops if you're having a buildup of wax, and this will allow the wax to become soft and come out of your ear, and then you can just clean the outside of the ear with cotton wool. Do not put anything inside the ear canal. If you're putting things like cotton buds inside the ear canal, you could damage the canal and scrape the edges. You can also push further towards the eardrum, so it's safer not to put anything inside your ear. The inner ear is composed of essential parts like your cochlea or your eardrum, which is essential with hearing and balance. There's around 15,000 cells on your eardrum, which helps to convert all the sound signals to brain signals and sends the information towards your body. Who knew that such a small part of your body could have such an essential role? Issues with your inner ear could include sensory neural hearing loss, Meniere's disease, labyrinthitis. Simply put, the outside of your ear transfers all those sounds towards your inner ear, and the inner ear is a multitasker. It turns all those sounds into signals for your brain whilst also maintaining balance. What's behind ear infections? Well, ear infections can be a little bit mysterious. It can be hard to figure out whether they're bacterial, viral, or fungal. Most ear infections are caused by bacteria or viruses, including these common suspects are behind a lot of ear infections. That's because they can block your Eustachian tube, and these are delicate tubes that connect our ears with our sinuses and throat. These tubes have an essential role in regulating ear pressure and draining fluid away from the middle ear. Causes of Eustachian tube blockages include seasonal allergies, common colds, sinusitis, excessive mucus production, smoking, and rapid changes in air pressure like flying. Now let's dive deep into ear infection symptoms. Ear infections come with a specific set of signals that you need to watch out for. With an outer ear infection, this is generally when the canal or the earlobe is infected, so therefore you might get some discharge, some fluid, some tenderness as you touch around the earlobe or the front part called your trachea. And if you have an inner ear infection, you might have severe pain inside your ear, a continuous sense of pressure, some temperatures of feeling really unwell, vomiting, and some hearing changes. Some people just get the one-off ear infections, and other people get repeated ear infections. But rest assured, there's lots of good treatments out there for you. With children, it's important to be a bit careful because they can't always express where they have pain, so you might have to have a high index of suspicion if they're getting a high temperature or feeling unwell, and see the doctor if you're not sure. Often with ear infections, we find that they can last around 3 days, and some can last a bit longer, around a week. Children are generally more likely to get ear infections because their Eustachian tube is shorter and narrower, making them the perfect culprits for infections to lead to ear infections. Of course, there are other things that increase your likelihood of getting an ear infection. Common risk factors include changes in altitude, changes in weather, recent viral illnesses, being male. When to see a doctor? If you've had the symptoms that I mentioned and you've had them for over 3 days, you're feeling really unwell, you're not sure what's going on, or you've had recent ear infections and it keeps coming back, then it's generally best to speak to a doctor. If you've had recent ear infections and you feel better, but your hearing is not back to normal, that's another sign you need to see a doctor. It's important to get urgent medical advice if you're feeling very unwell, you have a high temperature, you have swelling around your ear, you've noticed fluid or discharge coming from your ear, you've got a long-term health condition like diabetes, you've got a change of hearing and you cannot hear anything from your ear. How to diagnose an ear infection? If you decide to see a doctor, we will normally check your symptoms, ask you what's going on, how long it's been there for, whether or not you have any discharge, and then we'll probably take a look inside your ear with something called an otoscope. An otoscope is a small camera that allows us to look inside. With an inner ear infection, and generally you have to pain a bit deeper, we'll use an otoscope to look inside the ear and we'll be looking at your eardrum. We'll look for if there's any fluid or discharge around your eardrum. We'll also be looking whether your eardrum is bulging, swollen, has a hole in it, if it's red. If you have symptoms of an outer ear infection, generally we'll look at the canal itself and the earlobe. We'll look for any skin changes or redness in the ear canal, anything that could signal an outer ear infection. Another clue for an outer ear infection is when we touch here or touch here or here. If you're having a lot of tenderness around the ear canal, that's generally an outer ear infection. If we've had a look at your ear and we're still not sure what's going on, sometimes we could refer onwards to a specialist. We could send a sample of the fluid off to the lab to see if it's got any bacteria or viruses or fungus inside. We could also sometimes arrange an MRI scan or a CT scan to have a more detailed look into the ear canals. Treating ear infections. Generally, most ear infections clear up in about 3 days and some last up to a week. But if it's been 3 days and you're not feeling better and you've tried some self-care, it's important to see a doctor. Some home remedies you might want to try is number 1, pain relief that's safe for you to take. Number 2, warm compresses around your ear canal. Number 3, remember that oral decongestants and antihistamines don't generally benefit ear infections. My worst ear infection was when I was in New Zealand and I decided to do a skydive. I had a cold at the time and I remember jumping from the plane, and as I did that I had horrible pressure in my sinuses and my ears, and soon after which, the next day, I developed an ear infection. Inner ear infections. Most inner ear infections will resolve in around 3 days and some last up to a week. Generally, as a doctor, I'm more likely to give antibiotics if your symptoms have lasted more than 3 days, you've got fluid coming from your ear, you've got underlying risk factors like a weakened immune system or cancer treatment, for example, or it's affecting your day-to-day life and you cannot function. Treatments for an outer ear infection. This is generally when your earlobe or ear canal has an infection, and we might consider things like antibiotic drops if it's bacterial, steroid drops to reduce swelling, antifungal if we think you've got a fungal infection, or oral antibiotics in some cases. Remember, when you've been given eardrops from a doctor, it's essential to apply them correctly. Make sure you follow the instructions on the packet. Are ear infections contagious? Ear infections are not contagious, but as I mentioned earlier, they can be spread from bacteria, viruses or funguses, and these causes could be infectious. If someone has a cough or a cold and are sneezing and coughing everywhere and also have a viral ear infection, if you're standing near them, you could be exposed to the virus that's causing their ear infection. If an ear infection outstays their welcome, you might notice that some people have changes in their hearing, or it might lead to speech delay in children, or more serious consequences like mastoiditis, which is when the bone behind your ear gets infected. A common question I get asked as a doctor is, can you fly with an ear infection? If you're struggling with a common cold, allergy or an ear infection, you might want to consider changing your dates. The reason is that as you're flying, your ears are already under pressure due to the takeoff and landing and the changes in air pressure, and your ears are essential in balance and regulating the pressure. As the plane takes off and lands, the middle part of your ear is there to regulate pressure. The middle ear, located behind your eardrum, connects with the back of your throat through the Eustachian tube. As cabin pressure shifts, this tube plays a key role in regulating the pressure. It works hard to stabilize the middle ear's pressure by adjusting airflow. This is what leads to you having all those popping sensations during takeoff and landing. That's the Eustachian tube doing its job. However, when you have an ear infection and you're already having ear pressure changes during takeoff and landing, this is what can lead to severe pain in your ear. When you're doing scuba diving or hiking and you have an infection, these can also exacerbate your ear infection symptoms. Here are some tips if postponing your flight is not an option. How do you regulate your ear pressure? Well, you could try to take a decongestant tablet or spray. You could try sucking sweets during takeoff and landing. You could try yawning. You could try to hold your nose and your mouth closed and blow out. Thank you for watching today's video, and I hope you know the difference between outer, inner, when we treat it, and what to watch out for. If you're not sure what's going on, or you've had a recent ear infection and things don't feel back to normal, speak to a doctor. And just to reassure you that most ear infections pass in a couple of days, feel uncomfortable, but try my self-care tips to help you with your symptoms. Thank you for watching. Please subscribe and write down your favorite ear infection treatments down in the comments below, and I'll respond. Thank you for watching. Bye bye.